What was the initial vision behind establishing such a comprehensive healthcare group?
So when we started People Tree Hospital, we started with this powerful vision to touch, move and inspire 1 billion people. The recent statistics says that 1 in every 5 of us or 1 in every 4 of us require mental health support at any point of our life.
Whereas conversely, you hear various facilities sell themselves as holistic, but that's not the experience the patient has.
However healthy a person is, but if that person is having mental health issues, then they do not even enjoy their physical well-being without the mental health issues being addressed.
Welcome to this episode of The Mind Reimagined, Paths to Wellness with Maarga Mind Care. I'm Ellen Chamberlain, I'm your host, and this week we will speak with Dr. Jothi, who is one of the founders, the promoter, and CEO MD of People Tree Hospitals, which of course includes this facility, Maarga Mind Care. Her medical specialization is as a senior consultant obstetrician and gynecologist with over 30 years of experience. She also specializes in infertility, and she is an inspirational figure in healthcare entrepreneurship. Given this, the interview questions will reflect her unique position as both a medical doctor, though not a psychiatrist, and a founder and leader in a large hospital group that includes such a special, dedicated mental health facility. That being said, let's go. Here's the episode. Dr. Jothi, thank you so much for joining us today. As a founder and leader of People Tree Hospitals, including Maarga Mind Care, what was the initial vision behind establishing such a comprehensive healthcare group?
So when we started People Tree Hospital, we started with this powerful vision to touch, move and inspire 1 billion people, but with a simple mission to provide a type of care to all the patients who walk in, the type of care that we would want for our own family, friends and relatives. So if you see in this mission, there's no complexities, nothing complicated, very simple. Just like when our own family members walk into the hospital, how would we want them to be treated? The similar type of care would be provided to every person who walks into our hospital. So this was our mission. And at the very initial stage, we also realized that the healthcare is not complete without mental health being addressed. So in spite of having treating thousands of patients in our hospital across several departments, but when the mental health is not addressed, then there is no complete care provided. So we realized it in our initial stages of starting People Tree, and hence we started a standalone mental health unit called Maarga.
What were some of the key challenges you faced in founding and growing People Tree Hospitals?
Starting People Tree Hospital was not easy. We went through lots of hurdles, the similar type of challenges anybody would face when we are creating something and growing something new, from financial hurdles to skepticism, doubt, because we are starting one more hospital, a healthcare facility. But the vision and mission with which we started about providing a type of care we would want for our own family members, that made things much easier for us to just keep on carrying with what we were doing. And one beautiful thing what happened is the people who started with us, our teams, our clinical teams, non-clinical teams, everybody started with the similar mission. And that mission was not something very difficult or didn't come with lots of complexity. So it was very easy from day one to address the challenges and to move on in our journey.
That's great. I heard you talk about the doubt and skepticism, yes. And I'm assuming it came internally as well as externally.
Very true. You said it. So yes, it was internally and externally. So one is the doubt and skepticism as a women leader. Would I be able to take it forward? Would I be able to deliver? That was always there around me, around all of us.
Maarga Mind Care is highlighted as a unique standalone hospital for mental health. What specific gap in the healthcare landscape were you aiming to address by creating a dedicated mental health unit within the People-Tree Hospital's framework?
For a long time in India, mental health was neglected and not prioritized, and also it was stigmatized. So the recent statistics says that 1 in every 5 of us or 1 in every 4 of us require mental health support at any point of our life. But then the access is not even 10%. The reach or the availability is not even 10%. So this is the gap we wanted to address, number one. Number two is we also wanted to create the state-of-art facility. When I say state-of-art facility, with international standards where mental health care is delivered with dignity, not only with compassion but also with dignity. And number three, creating awareness. Without creating awareness, we cannot bridge this gap. Because in India, even today, people hide behind to come out and seek help for mental health. The family members hide the fact that one of the family members require mental health support or are undergoing a mental health issue. They still hide behind the screens. They do not come out into the open. They do not seek help because they are worried about the society. So at a broader vision, we need to first create that awareness. So these are the three gaps we wanted to address. So at the initial stages of starting People-Tree, we realized this, and then we started this mental health facility where mental health care is provided with both compassion, dignity and confidentiality, and we do not want the people to hide behind the stigma.
So let me just take a little side journey here. When you first started, did you intend, when you were creating the mission, to be using some of you talked about world standards. So Maarga implements some modalities that are world standard that are very new to India. Was that part of the plan in the beginning, or is that something that you sort of expanded to embrace at Maarga?
I have to admit, we actually, in our journey, we embraced this in Maarga. That wasn't the plan initially when we started People-Tree, but very soon, like I said, very soon in our journey, when we started People-Tree, we started expanding our other departments like general medicine to surgery, orthopedics, neuro, cardio, all other departments. But then we always felt that gap, mental health is not being addressed. And then Maarga was born out of addressing this gap. And also as an obstetrician and gynecologist, I've always dealt with women in their most sensitive and most vulnerable time of their lives. And the statistics says 10 to 20% of women undergo postpartum depression and postpartum psychosis. So being a clinician, I've seen that part of the need where, mental health has to be addressed. And that's how Maarga was born.
So let's talk about the healthcare philosophy that you have as the CEO and the MD. How do you balance your responsibilities of strategic leadership and business management with ensuring high-quality patient care across all People-Tree hospitals, including Maarga?
So as a CEO and MD, yes, my responsibility is towards strategic decision as well as business management. But before that, I would want to remind you, I am a doctor. I am a clinician with my clinical experience of close to 3 decades, and now being the CEO and MD, I think I have that additional advantage or the strength to balance both clinical excellence, patient care, not compromising on the quality and standards along with business management. My clinical team, both the doctors, nurses, my paramedics, are empowered to always put the patient first. So our focus is to be patient-centric. So there is no deviation from this. So when my clinical team and my other support teams are dedicated towards being patient-centric without compromise on the quality and clinical excellence, so I am empowered to concentrate on my strategic decision and business management.
That's the best way to go, absolutely. One thing I've learned as I've talked to doctors at Maarga, and it's just echoing from you, which is top-down philosophy, right? Holistic. When I spoke with Dr. Girish, I noticed that everything we were talking about, we're talking about a holistic care model without using the word holistic. Whereas conversely, you hear various facilities sell themselves as holistic, but that's not the experience the patient has. So how do you implement that on the day-to-day? How do you translate that from Maarga to other departments at PeopleTree?
Yeah, but that I would say that could be vice versa as well. Because at PeopleTree, we have close to 20 plus departments. So from general medicine to orthopedics, cardiology, we have critical care, so trauma, emergency. So we'll come to general medicine. Any chronic illnesses, could be diabetes, hypertension, obesity, they do go through some sort of stress when their clinical problems, because these are all long-term chronic, we call them as chronic illnesses. So for a person to accept the fact that he or she is a diabetic or hypertensive, or maybe the BMI is high, and then lifetime they need to keep on making modifications about their diet, about taking medications on time. So definitely some people go through some amount of mental stress or anxiety, which we need to address. Likewise, it could be a trauma, an unexpected accident. I'm sure the post-traumatic stress is huge. And any patient going into the ICU, coming out of the ICU, the fear of the patient and the family members, I think that is the integration we are doing. So we understand that every other health issue could have a requirement of a mental health support at some point in their lifetime.
Has someone in the family has an accident. So PeopleTree doctors have it in their mind, and they offer people this second level of care, the second layer of mental health support if they would like it.
Oh yes, definitely.
As we were discussing, I was then realizing that your doctors must, as soon as a family comes in with a sudden situation, part of the protocol is to offer mental health support as another layer of their recovery from whatever their issue is.
Yes, our doctors in PeopleTree, the emergency doctors, the ICU doctors, patients who have been admitted with a road traffic accident, trauma, critical care. So they always know that the mental health support has to be sought after, and then we do provide the psychiatric and the psychology services to our patients. And not only that, I would also want to add here, there are other major hospitals in the city, the oncology, the cancer hospitals, the other multi-speciality hospitals, especially the women and child hospitals, where we provide psychiatric services and the psychiatric support for them.
As an outside provider?
As a service provider.
Wow,
yeah.
That's wonderful. That's impressive.
We support them with our psychiatric and psychology services.
That is wonderful. So wherever you are, you're probably being treated by Maarga, whether you know it or not. What's your perspective on the evolving role of technology and innovation in delivering healthcare services, particularly in mental health within your hospital group?
In Maarga, we not only do telemedicine, but we also have the latest technology as one of the modalities of treatments to treat our patients. Especially, we have the latest technologies of different modalities of neuromodulation, like the TMS, the TDCS, and also we have something called as ketamine therapy, which we do extensively for our patients, and we have got excellent results. So our vision to fill the gap in in the huge gap in the mental health spaces to have something called as hybrid clinics. The we also have a mental health app where we are at least able, patient who cannot physically come to our hospital and to our clinics can take the support of our psychiatrists and psychologists using this telemedicine or the technology platform.
Okay, so as we look ahead, what are the next significant milestones or initiatives you envision for Maarga Mind Care to further enhance healthcare, which mental health is health? What would you like to see happen for accessibility and quality at Maarga and in the region?
Our initial goals is to first expand accessibility and awareness, especially in mental health. Without awareness, the people who are actually in need also do not get access to mental health unless they are aware that there is mental health support available out there, and they need to come out into the open and seek help. So our priority is two things. One is to create that awareness and expand the awareness, as well as to expand the accessibility. So we are in the plan of, and we have certain goals to create that awareness, as in training protocols to the community healthcare providers, which we have in Maarga something called as the Maarga Siksha, where we have certain training programs once in a month, once in 2 weeks, where we reach out to the mental health service providers like the psychologists, the patient care attenders, and the mental health care providers. We call them to Maarga, and then we give them the training. How do they actually go out into the community and create the awareness and clear the stigma around this mental health? So that is one thing. So once the awareness increases, then the need or the people looking out for mental health help definitely increases. And then we bridge the gap by increasing the accessibility, by creating more mental health centers, mental health clinics, mental health hospitals like the one we have now, Maarga in Bangalore, North Bangalore. And also, like I said earlier, by bridging the gap using technology as well, either in the form of app or a technology-driven hybrid clinics, especially in the 2-tier and the rural parts of India.
That's fantastic. What message would you like to convey to the community regarding the importance of integrating mental health services within their own general health care and the role of facilities like Maarga in achieving this?
In India, especially in the rural and the smaller towns, we still have family physicians, we have the general practitioners, we have the healthcare providers from the government side who reach out to the community, to the village people, and provide them all the basic health needs, the preventative health care and all of that. So I think the first thing is we need to train them. Because this sector of the population, they actually believe and trust their local doctors and their local community leaders or the community heads. So when these people are able to actually impart that knowledge to them, saying that mental health is equally important and there is no holistic health without mental health issues being addressed. However healthy a person is, but if the person is having mental health issues, then they do not even enjoy their physical well-being without the mental health issues being addressed. So we could actually create bigger groups or community groups, including the doctors from our local communities, the other community workers, and then along with them impart that knowledge and that awareness about how important mental health is. So this is one thing which we want to do, and we are actually in that process now. So my vision is to tell to anybody and everybody, if a person or a family member is suffering with mental health issues or have some kind of mental health problems, do not hesitate to seek help. Help is available, and any mental health issue is the same or equally important as any physical problem. They do not have to undergo some amount of shame or stigma or any worry, rather than seeking help and in the right time. And I think most of the mental health issues can be addressed, and then we are looking at creating a more healthier and happier community.
It's all about talking about it, and that's
It's all about talking.
I'm really enjoying learning more and more about Maarga, and I look forward to seeing you again for a special episode on postpartum health. So thanks very much for joining today, and have a great day.
Thank you so much.
Okay.
Thank you.
That was interesting. I learned a lot today. I look forward to the next episode, and I hope you'll join me. And we have been discussing The Mind Reimagined, a path to wellness with Maarga Mind Care. Thanks for joining.